Hola, bienvenidos a todos a este Congreso de la Sociedad Española del Dolor. Nos encontramos ante el doctor Silviu Brill, que es el director de la unidad de dolor del Tel Aviv Medical Center en Israel, en Tel Aviv. También es secretario de la Sociedad Europea del Dolor. Un profesional con gran experiencia en el tratamiento del dolor crónico con cannabinoides. Entonces es una gran oportunidad tenerle aquí. Le voy a preguntar por la situación del cannabis medicinal en Israel. So, hello, Dr. Brill.
Thank you very much.
Very nice for us to be here.
My pleasure and honor to be part of your congress and to be in Spain.
Very good. Could you tell us briefly how is the situation in Israel, in your country, with medical cannabis?
Oh, it's not that easy to say in few words how is the situation. However, we start, let's say 15 years ago to treat medical patients with cannabis under a legal way, and we have now more than 100,000 patients treated with cannabis under medical condition, mainly for chronic pain. Let's say 70-80% are treated for chronic pain, and 20-25% are treated for neurological cancer or other diseases. It's a tremendous increase, and probably we are the country with a higher percent per population treated for medical cannabis in the world. We are trying I think we are succeeding to go only for medical criteria and to be very strict. However, it's not 100% that we can do, because it's a big pressure from the patients on the other way, and also politician is an implication of many factors when we're going to the cannabis. We're trying to do our best. We have guidelines and we have lessons and education for doctors and for patients. However, it's a very, very big gap in terms of education for medical students, doctors and professionals regarding cannabis and chronic pain or other diseases treated by cannabis. A big change in our world was a sort of reform in terms of how we are providing, not us, but the companies are providing cannabis to the patient. There are very strict rules how they are producing, how they are selling, how they are keeping their products. So other days we know much more what the patients are receiving, but not completely, because there is in our market 80% of the patients are receiving flower, so for smoking, and only 20% are receiving oil. So it's not what we want to do. We do not want to give our patients to smoke. It's against our will not to smoke. So this is a very big problem in our market.
Okay, that's
a few words. Yes.
That's a few words, and it's like a view to the future, because we are starting here in Spain, and we even don't have any regulations so far. It's very good to see your situation, because for us it's looking 30 years ahead.
Way to the future. Don't make our mistakes. First of all, learn from other countries, and let's say, make rules for the beginning and try to stick to the rules. Also for the patients, for the doctors, and for the growers and the people who are going to sell the cannabis. Make it very strict. Try to be as close as possible as a real medication. It's not the same, but try to be as close as possible. When you prescribe painkillers, you know the rules. Don't make soft rules for cannabis. This is one way. Second, make a very clear policy of how to start, how to follow out the patient, and how to stop. This is a more difficult way. Make rules for elderly patients, for frail population, let's say for children, for pregnancy, and for other kind of disease at the age. Don't put together recreational on the other hand and medical way to use. And again, there is all the times in all the country the sword of legalization. Don't go there. This is not a medical decision. Legalization is fair enough to be, but it's a very political decision. It's not a medical decision to legalize or not legalize cannabis. And make a very clear list of indication. Let's say chronic pain under each circumstance, cancer pain under each, autism for kids, epilepsy, Crohn's disease, and for each of these problems, make a form of 3, 4, 5, 10 specialists who are recognized in your country that will be in charge of these problems. And make, let's say, every 2-3 years, reanalyze them to see what's going on in the market. We have problem, we don't have problem, what's going on.
Mm-hmm. So supervision, strict supervision of the patient, and always take a look at what we are doing.
Yeah. And very, very important, last but not least, education. Because I haven't been said nothing in the medical school, probably not you, what's cannabis, how to treat patients, or not in the medical faculty, not in general specialization, not after that. Make very clear courses of SED or Ministry of Health or faculties, how to improve the knowledge of the doctors and also for the education, because they think that is a panacea, will treat everything. And this is not true. We have side effects, we have problems, it's not effective for everyone, and this is one way. And the second way, give when you prescribe paracetamol, you know how to say to your patient how to take it. When we prescribe an opioids, you know exactly how to explain. But when you prescribe, let's say, try to use joint of cannabis, you don't know really. I'm not smoking, so I'm not a person to explain. You need to make a group or forum, nurses or cannabis specialists, that the patient can address and ask how to use and receive assessment and advice. It's very, very important. I think it's a huge part of the success of the treatment.
Very good. So this is it. In brief words, the situation in Spain and in Israel. Thank you very much, Dr. Brill. I have learned a lot in these 5 minutes.
And I, as a last sentence, I said, it's not a panacea, but it's important part of our arsenalium to treat pain. I'm a pain specialist, so not taking to other kind of disease, but it's very important add to our arsenalium to help patients. Thank you very much for having me here.
Thank you very much.